What is the complete vaccination schedule for cystic fibrosis patients? Imagine a health plan designed to give cystic fibrosis patients the best possible protection against infections that could worsen their condition. That's what a carefully planned vaccination schedule aims to do. People with cystic fibrosis are more vulnerable to respiratory infections because their lungs are often compromised. So, their vaccination schedule includes all the standard vaccines recommended for their age, plus extra precautions to prevent serious illnesses. Starting with childhood vaccines, cystic fibrosis patients should receive all the routine immunizations. This includes the diphtheria, tetanus, and pertussis vaccines, which protect against dangerous bacterial infections. The inactivated polio vaccine helps prevent paralysis, while the Haemophilus influenzae type B vaccine guards against bacteria that can cause meningitis and pneumonia. The pneumococcal vaccines, both the conjugate vaccine and the polysaccharide vaccine, are especially important because pneumococcal bacteria can cause severe lung infections. MMR and varicella vaccines protect against measles, mumps, rubella, and chickenpox, which can also lead to serious complications in people with cystic fibrosis. The hepatitis B vaccine is essential for preventing liver infections, and annual influenza shots are strongly recommended starting at 6 months of age. With the ongoing COVID-19 pandemic, vaccination against the coronavirus is also a key part of the schedule, following current guidelines for age and health status. Because pneumococcal disease poses a significant risk for cystic fibrosis patients, the vaccination plan includes a series of pneumococcal conjugate vaccines in early childhood, followed by the pneumococcal polysaccharide vaccine at age 2 or older. A booster dose is typically given 5 years later to ensure continued protection. This combination helps reduce the chance of invasive pneumococcal infections, which can be life-threatening. Influenza vaccination is crucial each year for all cystic fibrosis patients aged 6 months and older. The inactivated flu shot is preferred because it is safe and effective, while the live attenuated nasal spray is generally not recommended for these patients. For COVID-19, vaccination is advised for all cystic fibrosis patients, especially those with more severe lung disease or who have had transplants. They should complete the primary series and receive booster doses as recommended by health authorities, with adjustments for immunocompromised individuals. Additional vaccines may be recommended based on age and individual risk factors. For example, hepatitis A vaccination is advised if not already given. Adolescents and young adults might need meningococcal vaccines if they have risk factors like splenectomy. The Tdap booster, which protects against tetanus, diphtheria, and pertussis, should be given every 10 years. The human papillomavirus vaccine is also recommended starting at age 9 to 12 to prevent certain cancers caused by the virus. For cystic fibrosis patients who have undergone organ transplants or are immunocompromised, vaccination plans are tailored carefully. They usually need additional doses of COVID-19 vaccines and should avoid live vaccines, which can be risky in these cases. It's important for these patients to work closely with their healthcare team to determine the best timing and type of vaccines. If a cystic fibrosis patient has missed some vaccines, catch-up immunizations should be done promptly following official schedules. This helps ensure they are fully protected against preventable diseases. In summary, the vaccination schedule for cystic fibrosis patients is comprehensive and designed to address their increased vulnerability to respiratory and other infections. It includes all routine vaccines, with added emphasis on pneumococcal, influenza, and COVID-19 vaccines. For those with compromised immune systems, extra doses and careful planning are essential. Always consult healthcare providers to personalize the vaccination plan and keep up with the latest recommendations. Staying up to date with vaccines is a vital part of managing cystic fibrosis and maintaining good health.